Hey guys, welcome back to the channel. It's your girl Lori. If you're new here, welcome to the channel. I am an alternative therapist. So what does that mean? Okay, so I do traditional therapy, but I also blend that with energy work, and I also am a person who has struggled with a lot of anxiety, depression, OCD, obsessive thinking, you name it, your girl got it. So if that interests you and that's the kind of content that you don't mind watching, hit the bell in the corner, subscribe, hit the bell in the corner for notification. You'll get notified every time I post. Let's jump into, could it be ADD that's creating your depression? So hi guys, so with me I have my friend and Dr. Michelle Jordan. So I know a lot of you have asked me on some of my other platforms, like, why would ADD, why would you need to treat the ADD and not know that it's the depression? And how would one possibly be able to differentiate that?
Oh, that's a good question. That's a big subject. So as Lori affectionately calls me, Dr. Michelle, I'm a nurse practitioner, nurse midwife, and have a doctorate degree. That's why I get to be called doctor. And I work a lot with mental health because our community has no mental health. Well, we're limited resources.
Very limited, very limited.
Anxiety, depression, ADD, mood disorders, we lump them under a big classification of mental health. There's a lot of stigma. There's in our society, we don't want to feel like we've got something wrong, or we're weak, or as I've heard recently, that I'm crazy, or things like that. People don't understand their emotions and what they're feeling, and these things are all intertwined. If you think about all this, the three circles, you have three circles and they all overlap and there's something in the middle. It's very hard to tell what is in the very middle. And so sometimes we're stabbing in the dark to try and figure out what we're treating. Is it anxiety? Is it depression? Is it ADD? And we find out that sometimes what's above the water is just the little tip of the iceberg, and underneath is the Titanic killer, and it has all the other little symptoms underneath there. So the first thing that you can do is find a trusted professional care provider to help guide you through your journey of finding out what's going on with you, whether that is your counselor, a different therapist, your clergy member,
Your doctor.
You find your health provider as well, because there's testing that can be done. We can do lots of objective testing. We do lots of subjective testing as well. Also, discussing symptoms. That's a big thing.
Yeah.
And getting to the root of what the symptoms are. Why can it be? So ADD is not always, we think of ADD as the little kid that's bouncing off the wall, like they've had too much sugar. That is not necessarily ADD or ADHD, attention deficit disorder, attention deficit hyperactivity disorder. There's that definition, that distinction of that hyperactivity component. And sometimes we think that what we're treating is depression and anxiety, but we're wrongly missing out on that attention deficit piece that prevents us from fully
being able to treat it, right?
Yeah, or functioning.
Functioning, yeah.
Yeah.
Well, and I think too, isn't it kind of like hard because it's like the chicken and the egg? Like, is it the ADD causing the depression? Or maybe that's a better question. Is that something that you have found, or that you are seeing some in the research? Does it seem like sometimes that anxiety and depression seems to be caused more from the ADD, or does the ADD, is that a byproduct? Or is it the other way around? Like, is it? Like,
I think it's the other way around.
Okay.
So I think what we're learning, the state of the research is growing.
Yes.
It's growing. We're learning so much more in a very different way, especially with the state of affairs that our world is in right now. We're learning more about what is coming first, the chicken or the egg. We're picking it up a little bit better. I think that what I'm seeing more of, especially with adults, is ADD that is being treated as depression and anxiety, when really the root is the ADD. Mm-hmm. So we're treating them with antidepressants and mood stabilizers, when maybe we should be treating them a little bit differently. Maybe if we treated that, if we helped their brain a little bit differently, then they would utilize their neurochemicals a little bit better, and then we wouldn't need a ton less medication.
Yeah, yeah. And I think that, you know, that's one of the reasons why I wanted to hop on here with her, just kind of talk to you guys about it, because I think so many people get like stressed out and worried when their medicine isn't working, but maybe you're treating the secondary issue, the byproduct issue, and you're not treating the heart of the issue.
Exactly. And, you know, from experience, once that gets figured out, it's life-changing. So if you feel like you're being treated for depression or anxiety and you don't feel like it's helping, it's not working, you're still struggling, reach out to your care provider and say, I need to have a different discussion with you, because they may be treating a symptom, not the issue, and
That's
not
right.
the disorder. I mean, yes, depression is a major depressive disorder, generalized anxiety disorder. Those are real disorders. Those are real things. They don't have to be with attention deficit disorder, but they also are byproducts of other issues as well. So making sure that you're treated appropriately is absolutely exponential. And I think, you know, of course, we look at the way to treat the two different things. It's one thing to be on something like Zoloft or Lexapro, which is an antidepressant, and it's different to be on something like Adderall or Vyvanse, which, you know, are considered
A stimulant?
it's a stimulant, and it's a they are controlled substances. So there's a little bit of stigma there, and, you know, but the difference in treatment can be life-altering.
In a good way.
Absolutely.
In a fabulous way.
Absolutely.
So yeah, so thanks for joining me, and just wanted to hop on and give you guys a resource. If you're, like I said, if you're interested, please consider subscribing, hitting the bell in the corner for notification, and maybe if you love her and you want her to come back, she'll do more with me. All right, I'll talk to you guys later.